Hi, my name's Hans. I'm going to be your student nurse today. How are you doing?
I'm good.
Good. Can I ask you your name and date of birth?
It's Darla Hayes, 7/31/1937.
Alrighty, Darla Hayes. Can I ask you if you have any pain right now?
Not too much pain right now. I got some medication not too long ago.
Alright, awesome. Cool. Can I ask you if you have any allergies, Darla?
Just some pork.
Just some pork?
Yeah.
Oh man, no bacon?
No.
Oh, that's my favorite, Darla. Okay, once I get my hands washed, I'll come over there and actually talk to you face to face. Sorry about that. I gotta get my hands clean though. Alright. Okay, then can you just tell me your name one more time?
Darla Hayes.
Alright, Darla, so my name's Hobbs. If I didn't say this already, I'm your student nurse for today. And can I ask you your date of birth?
7/31/1937.
Alright, and then any allergies one more time?
Pork.
Pork, alright, okay. And then can I ask you if you're having any pain right now?
No.
No?
Nope, no pain.
Alright, so that makes sense because you had your pain medication 40 minutes ago. Do you know why I'm here today?
I'm assuming it's my leg.
Alright, it is for your leg. I'm going to go ahead and put you up so I can see you better and not break my back. So yes, it is for your leg. We're just here to do your leg, clean it out, and culture it. Is that okay with you?
I suppose.
Alright, awesome. So I'm just going to go ahead and put a chutz. It's on your right leg, correct?
Yeah.
Alright, I can see the bandage. It's going to be a little cold. Ooh, out from under the blanket. Okay, so I'm just going to go ahead. Is this okay if I put this trash bag at the foot of your bed?
I don't mind.
Alright, right there. Okay. I'm going to throw this pad under your leg. Alright. Come on, bag, cooperate. There we go. Okay, Darla, and then I'm just going to go ahead and unwrap your bandage here. Alright, it looks like your wound's getting a little bit better. That's good. Okay, Darla, I'm gonna go ahead and go grab some clean gloves. Actually, I'm gonna go perform some hand hygiene and then I'll be right back. Okay? Hand hygiene. We're gonna pretend there's hand sanitizer right here. Hand hygiene. Now that I have clean hands, I'm gonna go ahead and open my sterile kit. Coming from the edges. Darla, is it okay if I put my gloves on your chest, my sterile gloves?
Yeah, that's fine.
ensuring that I stay within that 1-inch border. Grab the first glove from the inside to maintain sterility. I think that's a verb. Alright, woo! Next I'm gonna go just like such, grabbing from the outside. And then once I have both my gloves on, then I can adjust the thumb accordingly. Same with this thumb. Okay, now that I have my sterile hands, I'm gonna go grab the paper from the middle, grabbing the corners, using only the corners, maintain that 1 inch. Grabbing the corners, okay. I'm gonna pick everything out slowly, maintaining that 1-inch border. The correction would be making sure I put the glove on correctly. However, in lecture we talked about sometimes you do put in 2 fingers in 1 hole, but you just gotta go because it's an emergency. And so that is something that I will work on and make a correction for next time. But I still have sterile gloves, so I still maintain in the parameters of sterility. I think that's a word. Anyways, next I'm going to grab this, come around, not getting my armpit juice all over the sterile field. As such, not splashing anywhere. Okay, next I would take my gauze pads, and Lisa showed us this trick of taking them apart like this first. Just kind of helps in the process. All right. Okay, next I'm going to debride the wound. Okay, so from here on out, I'm going to use the pass method. Working from the inside out, keeping my other hand in the sterile field. And then I would want to pass these off to each other without touching each glove so that this field stays clean. Working inside out. Okay, now that this glove is dirty, I now just have clean gloves, no longer sterile. I'm gonna open up my packages. I'm gonna open up both of these without touching them to maintain their sterility. I'd like to make a correction because we have to reuse these because it just fell on the floor. What I would do is open it like this and dump it into the sterile field. I'm gonna go ahead and grab it. We have to reuse these, and so it's already open, so they fall out easy. Okay, pretending that did not happen, grab my other. I would open it as such, ensuring that I don't touch the insides because it's sterile, just like this cotton swab. Opening it, getting it to drop into that sterile field. All right, I'll take both of these, discard them, and then I would change my gloves and put on new sterile gloves. I would perform hand hygiene. Go over to I'd turn 25 degrees. I would put on my new sterile gloves. They don't make these things big enough. Sometimes it's a tough fit. There we go. Only touching the inside because I don't have a glove on my exposed hand. And then with my sterile glove, I would grab the outside of it using this technique. Ensuring that I don't touch the inside because the inside is not sterile right now. And then once I have both gloves on, I can adjust them as fit. Okay. Now that I have sterile gloves, I'm gonna measure her wound. Grabbing my measuring device. I would not let it touch the skin. So it's about 9 centimeters long. And then I would also measure the biggest width, which is 5 centimeters, but she's also got kind of a narrower spot up there, so I'd also measure that, which is 4 centimeters. So 9 by 5 and 4. I'll place this right there. This top is still sterile. Next, I would grab our measuring cotton stick. I would go to the deepest part of the wound, put my finger up to it, ensuring not to touch the skin to maintain sterility, and then I would put it up to the measuring tape without touching it. So about 2 centimeters deep. After that, I would discard of that. I would grab this from the center, discard. Now I'm still sterile. Next I would do is culture the wound. Grabbing my culture, these are still sterile. And what I would do is I would take this and get all around the wound, twisting it to make sure you cover the whole cotton swab all over the wound. This just makes sure you get all of those bacterias. Okay. I would put it in the tube. All right. And then I would label it. Darla Hayes, 1979. All right. Okay. And then this would be taken off to our lab later. Now that we cultured and we cleaned out, debrided, next what we're gonna wanna do is pack the wound. So we're gonna grab our Xeriform, ensuring that I don't touch the outsides. We'll put it over the wound, pack it. And then you also want to make sure it comes out an inch from the outsides of the wound. Okay, and then actually what we learned today in sim with Miss Lisa is you can put a gauze over that, sterile gauze, just to make sure it doesn't slide around, just as an extra form. And then we grab our ABD pad, and at this point, I'm no longer sterile. I will grab my gauze. And pack it from upwards down to ensure good circulation. All right, then we would use our tape. Not putting the tape over the wound area, over the sides. And then we would also label it with our initials and date. Not putting it over the wound or writing on the patient. Lisa said, do not write on the patient. It's not good. Which I agree. Okay. So now that I'm no longer clean, I'm gonna go ahead and pack everything away. I would dispose of this in our tray. Dispose of everything. Roll it up. All right. Next, I would switch gloves. Perform hand hygiene. Sheep, sheep. Put on new gloves because our patient is contact precaution. So you don't want to touch it with their skin. And these are just clean gloves, not sterile. I would make the patient comfy, get her call light. Put her back down at the lowest position. Collar's next to you. Then I would ensure that this is for Darla Hayes, 1937. The date is 10/03/23. Okay, awesome. Let's see. I would make sure she's comfy. You okay?
I'm good.
Alright, your collar's right here. Your bed's at the lowest position. I would then take this, tie it off. Dispose of it in the facility's appropriate manner of biohazard waste. I'm either take with me out the door and go straight to the biohazard area, but before I leave the patient's room, I should go. So dispose of this how the facility wants it. And I would take my gloves off. First step. Perform hand hygiene. And I would take my gown off. Rolling it. Disposing of it. Wash my hands again. And then I would get new gloves. To take this with me. That's my correction. I would get new gloves to take this with me to the lab. And then I would pick this up, leave